They just had a major press conference giving updates on the Gene Hackman case. And forgive me, because I'm still kind of shook right now. The information they revealed totally caught me by surprise. And nothing catches me by surprise anymore. But these details definitely caught me off guard. Because there have been tons and tons of theories out there about what could have happened to Gene Hackman and his wife. Of course, I had my own personal theories, and you guys had your own theories as well. And maybe certain details within certain theories were proven to be correct, but no one, and I mean no one out there guessed this. It's kind of so almost unbelievable are so surprising that I'd rather you guys hear it from the horse's mouth. I'd rather you guys hear the press conference first before I give my takes, because I already know that a lot of people are not going to accept the answers that we were given. Now, personally, I accept the answers that were released in this press conference. I don't think everything has to be a big conspiracy all the time. But I'll admit, I still got questions because some of the details that were revealed in this press conference are kind of weird. In fact, look, I'm not going to dive into all of it right now. I'll let you guys watch for yourself. But it was revealed that it looks like Betsy died first. On the 11th, around the 11th. Now we know Gene Hackman died on like the 17th. So it appears that Gene Hackman was living in this home while his wife was dead on the ground, mummifying. And Gene Hackman was still alive in the house for like 6 days, 7 days after his wife was already gone. Now, some people would make the argument that Gene Hackman maybe wasn't in his right state of mind, or Gene Hackman couldn't move around. I was wondering if Gene Hackman fell on the ground and couldn't move and just, died from starvation and not getting water, just laying on the ground. But the autopsy showed that Gene Hackman was not dehydrated. Now, if you go like a week without some water or something to drink, you're going to be dehydrated. So at the very least, I don't know what was going on in that home, and we will probably never know. But at the very least, as Gene Hackman's wife lied on the ground in that bathroom for about a week, at the very least, Gene Hackman had something to drink. Gene Hackman was staying hydrated. So, kind of weird, but like I said, the cause of death for Betsy is even weirder. So let's go ahead and listen to this press conference, and then I'll be right back with some more thoughts.
Good afternoon, everybody. I'm Sheriff Adan Mendoza, Santa Fe County Sheriff's Office. With me today is Dr. Heather Giral, Chief Medical Investigator for the New Mexico Office of the Medical Investigator. Dr. Aaron Phipps, New Mexico State Public Health Veterinarian, New Mexico Department of Health, and also Chief Brian Moya, Santa Fe City Fire Department. This investigation started on February 26th with the discovery of Mr. Hackman and Miss Arakawa and their dog at the residence. I just want to do a short recap and then touch on some new information. As we know, both individuals tested negative for carbon monoxide. City Fire conducted tests and deemed scene safe for deputies to conduct their investigation. The preliminary pacemaker interrogation results were released last week, and I'll let Dr. Giral touch more specifically on those results. The gas company New Mexico, they also did an analysis of the residence, and they found one minor leak in a single burner on the kitchen stove, which was 0.33% of room air, which was pretty minute and insignificant. Since that time, Xena, the deceased dog, has been taken for necropsy at the Veterinary Diagnostic Services, and we'll be awaiting those results. Let's speak a little bit in reference to the timeline for Betsy Arakawa. We know from our investigation that on February 9th, 2025, she picked up Zena from Gruta Veterinary Hospital. There was a procedure that was done with the dog, which may explain why the dog was in a crate at the residence. Let's move on to February 11th, 2025. Mrs. Arakawa had an email conversation with her massage therapist at about 11:21 a.m. Moving on into the afternoon, Ms. Arakawa was at the Sprouts Farmers Market between 3:30 and 4:15 p.m. Ms. Arakawa was seen on surveillance video at the CVS pharmacy in Santa Fe from 4:12 to 4:20 p.m. She then stopped at a local pet food store at about 4:54 p.m. Her car was seen on surveillance, and the remote control clicker that is assigned to her and her vehicle was used to enter the subdivision to gain access to the gated community at 5:15 p.m. Numerous emails were unopened on her computer on February 11th. There was no additional outgoing communication from her or known activity after February 11th, 2025. The cell phone information and the cell phone data is pending. We're working with state police to get the information from those phones, but our investigation shows that all the last known communication and activity from Ms. Arakawa was on February 11th. I'm going to go ahead and turn over the podium to Dr. Gerald. I would ask that everybody refrain from asking questions until everybody has provided their statements. I'll step up to the podium and then we'll go ahead and field questions from the media. Thank you.
Good afternoon, and thank you for being here. I'm Dr. Heather Gerald, the Chief Medical Examiner for New Mexico at the Office of the Medical Investigator. I'd like to begin by stating that it is unprecedented for the Office of the Medical Investigator to make public statements about death investigations. However, the circumstances surrounding these two deaths require accurate dissemination of important information. I've also spoken with the Hackman family prior to this conference, who are aware of the autopsy findings and conclusions and are aware of this conference. On Thursday, February 27th, I performed an autopsy on Mr. Gene Hackman. Medical examiner Dr. Daniel Gallego at the Office of the Medical Investigator performed a full autopsy on Miss Betsy Arakawa Hackman. Also on Thursday, February 27th. By report, Miss Arakawa Hackman's legal name is Betsy Hackman, which is how she will be referred to hereafter. The cause of death for Miss Betsy Hackman, aged 65 years, is Hantavirus pulmonary syndrome. The manner of death is natural. Autopsy examination and full body postmortem CT demonstrated no findings of trauma internally or externally, with microscopic findings consistent with Hantavirus pulmonary syndrome. Laboratory testing was positive for Hantavirus at a clinical lab, with required confirmation testing positive at Scientific Laboratories Division. Testing for COVID-19, influenza, and other common respiratory viruses was negative. Testing for carbon monoxide was negative. There were no other significant natural disease findings. Pills present on scene were thyroid medication, which were being taken as prescribed and is not currently a concern for a contributory cause of death. The cause of death for Mr. Gene Hackman, aged 95 years, is hypertensive and atherosclerotic cardiovascular disease, with Alzheimer's disease as a significant contributory factor. Autopsy examination and a full-body postmortem CT examination demonstrated no acute findings of internal or external trauma and showed severe heart disease, including multiple surgical procedures involving the heart, evidence of prior heart attacks, and severe changes of the kidneys due to chronic high blood pressure. Examination of the brain showed advanced Alzheimer's disease, as well as blood vessel changes in the brain secondary to chronic high blood pressure. Laboratory testing performed at Scientific Laboratories Division was negative for COVID-19, influenza, and other common respiratory viruses. Testing for Hantavirus was negative. Testing for carbon monoxide was negative. Additionally, there were no autopsy findings concerning for Hantavirus infection. I have been asked when death occurred for these individuals. There is no reliable scientific method to accurately determine the exact time or date of death. Mr. Hackman's initial pacemaker data revealed cardiac activity on February 17th, with subsequent pacemaker interrogation demonstrating an abnormal rhythm of atrial fibrillation on February 18th, which was the last record of heart activity. Based on this information, it is reasonable to conclude that Mr. Hackman probably died around February 18th. Based on the circumstances, it is reasonable to conclude that Ms. Hackman passed away first, with February 11th being the last time that she was known to be alive. Lastly, clinically, hantavirus infection is characterized by flu-like symptoms consisting of fever, muscle aches, cough, sometimes vomiting and diarrhea that can progress to shortness of breath and cardiac or heart failure and lung failure. This occurs after a 1 to 8 week exposure to excrement from a primarily particular mouse species that carries hantavirus. The mortality of hantavirus, the mortality rate of the hantavirus strain in the Southwest is about 38 to 50%. The hantavirus strains in the United States are not transmissible from person to person. And so this is an appropriate time to segue to Dr. Aaron Phipps, the state public health veterinarian with the New Mexico Department of Health. But before I do so, I'd like to kindly ask for everyone to please respect the privacy that Mr. Gene Hackman, Miss Betsy Hackman, and their family and friends deserve. Thank you.
Thank you, Dr. Jarrell. I will now provide additional information about hantaviruses in New Mexico. There are many different types of hantaviruses found worldwide. These viruses are zoonotic, meaning they are transmitted from animals to humans. Hantaviruses are carried by rodents. The hantavirus found in New Mexico, the sin nombre virus, is found throughout the state, primarily in deer mice, but in other rodents as well. Hantavirus pulmonary syndrome is a rare disease caused by hantaviruses, but a small number of human infections are found every year in New Mexico. Over the past 5 years, New Mexico has confirmed between 1 and 7 hantavirus infections in humans each year. Through the end of 2024, we have identified 136 infections over the past 50 years in New Mexico residents, 5 of these in Santa Fe County. This is a serious disease. 42% of these infections here in New Mexico were fatal. Most transmission occurs around the patient's residence or workplace, and the New Mexico Department of Health typically conducts an environmental investigation at the residence of all hantavirus cases in our jurisdiction. This can help identify specific areas that may pose higher risk, providing insight into where transmission may have occurred and how to prevent future infections. On March 5th, the New Mexico Department of Health staff conducted a risk assessment of the property, including the main residence as well as other structures on the property. This was critically important to address concerns about health risks to first responders, as well as to inform any prevention measures needed to protect the family and other individuals entering the property in the future. We assessed the risk of exposure in the primary residence as low, similar to other well-maintained houses in New Mexico. We did identify signs of rodent entry in other structures on the property and provided information and resources about reducing the risk of hantavirus transmission related to those areas. Hantavirus can be transmitted to people through rodent urine, droppings, or saliva, so it is important to take special steps when cleaning up after rodents. Avoiding contact with or breathing in aerosolized rodent urine or feces, especially in a poorly ventilated area, is key. Detailed guidance can be found on the New Mexico Department of Health and the CDC websites, but I will provide a very brief summary now. It is important to use gloves and a well-fitting N95 mask when around or cleaning rodent-infested areas, and to open any windows or doors for at least 30 minutes beforehand to increase ventilation. Spray the area thoroughly with a 10% bleach solution or a commercial disinfectant. Let it sit for 5 minutes. Next, clean the area with paper towels, then throw them away in a covered garbage can that is regularly emptied. Before removing gloves, wash your gloved hands with soap and water or with a disinfectant, and then after removing gloves, wash your hands again with soap and water. It's important to never sweep up or vacuum mouse droppings, since this can spread particles up into the air. Since hantavirus is found throughout New Mexico, awareness of these risks and how to reduce them is important for all New Mexicans. The New Mexico Department of Health extends our deepest condolences to the families and friends during this difficult time. Thank you.
Thank you. I think that'll conclude the statements for today. We will go ahead and take questions. I ask that there be one question per agency, and please state who you're directing the question to, as there's several individuals here at this conference. Sir.
Sheriff, just to clarify the timeline here, does this mean Gene Hackman was likely home with his deceased wife for a week before he passed away himself?
Yes, I would assume that is the case.
Do you believe, given his Alzheimer's status, that Mr. Hackman was able to live on his own and survive for those 7 days?
I think that's more a question, maybe for Dr. Jarrell.
Just to repeat so that everyone could hear, the question was, do we believe that Mr. Hackman was able to live on his own and survive? The answer to that question is that Mr. Hackman showed evidence of advanced Alzheimer's disease. I'm not aware of what his normal daily functioning capability was. He was in a very poor state of health. He had significant heart disease, and I think ultimately that is what resulted in his death. I was able to look at fluid to determine if he was dehydrated, and I did not see evidence of dehydration. I did see evidence of very poor kidney function, and I think he died as a result of his heart disease, and with Alzheimer's being that contributing factor.
What about starvation?
The question was, what about starvation? So there was no food in his stomach, which means he had not eaten recently, but he had also no evidence of dehydration.
So based on your understanding of the progression of the Alzheimer's, do you believe that he was possibly not aware that his wife had died or didn't know what to do in that situation?
It's difficult to answer. The question was he aware that Miss Hackman had died? And I think that question's difficult to answer, but I can tell you that he was in an advanced state of Alzheimer's, and it's quite possible that he was not aware that she was deceased.
This is for the sheriff. Considering the circumstances under which Mr. Hackman was found in the mudroom with his walking cane and sunglasses by him, do you think there is a possibility that he was trying to get help for his wife?
That's hard to answer. Again, it's hard to get into the frame of mind of what was happening at the time. And I don't know if we'll ever have the answer to that question, whether he was going to go for help or he wasn't. Sir?
Sure. Are there any other big questions that you're trying to answer? I mean, does this answer the biggest questions you had about their death in this case? Is there anything else that you're really seeking?
Yeah, so the question is there any other big questions that are left? I think a lot of questions were answered here today. I think there was, Dr. Durrell went over the cause of death, and I think a lot of those questions are answered. I think the timeline that we've been given as far as the pacemaker results and the history and evidence that we found as far as the timeline of Miss Arakawa, I think a lot of the questions have been answered. We are waiting on the cell phones, but I would very unlikely that the cell phones are going to or show anything else. Another question?
Sheriff, are there any signs of, what have you learned about Mr. Hackman's communication after February 11th? Did you talk to any friends of his who had spoken with him during that week-long period, or know anything about what he was doing?
So the question is whether there was any communication from Mr. Hackman or activity, and no, at this point, no. I don't know if he used cell phones or technology or emails. There's no indication of that. So right now there is no activity from Mr. Hackman.
Sheriff, do you know if his pacemaker was connected to some sort of monitoring service? If anyone tipped off that something was wrong?
The question was his pacemaker connected to a monitoring service? The answer to that is that his physician, one of his physicians, had contacted me and told me that they could see the data from the 17th, but that to really get the most information from that would come from the interrogation of the pacemaker. And that's as much as I can answer, not being a cardiologist.
But they didn't say whether or not they were monitoring, or was his pacemaker equipped to send back data in exact time so that someone could say, hey, something's not right.
I can't answer that question, I'm sorry.
Question for you, Dr. Durrell.
Sheriff,
Sir.
Was there any footage that came from the body cam from the house?
I'm sorry, what was?
Was there any footage or anything that you can see from, like, body cam footage from the house? Any
Are you talking about the body cams that the investigator, the responding personnel were wearing?
Video? Is there any video?
No. So there was no outside surveillance or interior surveillance that we are aware of in the residence. So there was nothing to show the activity inside or outside the residence, and not at this time, no.
Dr. Durrell, you mentioned that one of the symptoms of Hantavirus is shortness of breath. We learned before that Betsy Hackman was laying on the floor when she was found. What kind of medical episodes would she have had to cause her to fall and then not be able to ask for help?
The question was regarding shortness of breath with hantavirus, and what kind of medical episode would we expect from somebody found on the floor. And I think to be able to answer that question fairly, it can go back to hantavirus infection, which initiates with what's called a prodromal phase. That's initially flu-like symptoms, where a person has fever and muscle aches, that they don't feel well. After, of course, being exposed to rodent excrement. And that phase can last roughly 3 to 6 days. And then they can transition to that pulmonary phase where they have fluid in their lungs and around their lungs. And at that point, a person can die very quickly, within 24 to 48 hours, roughly speaking, without medical treatment. It's not uncommon to find someone down on the floor as part of a terminal collapse, so to speak, And that may very well have been what happened to
So
Miss Hackman.
You're estimating her time of death on the 11th, or is it possible that she collapsed and was alive for a couple of days?
It's hard to say. I don't think she was on the floor alive for a couple of days. I think that she went through that time period, and I don't know when she began to feel ill. And those are just things that I don't know that I'm ever going to have the answers to. But I think, and going back to that initial time period, roughly 3 to 6 days of feeling ill and then succumbing pretty quickly after fluid begins to build up in the lungs.
Given the dog was created, is it fair to assume that the dog died from dehydration or starvation?
I don't think we know the answer to that. However, given the timelines presented, it is a possibility.
Is it possible the dog had the hantavirus?
Dogs do not get sick from hantavirus.
Sir.
You mentioned that Betsy Hackman went to the pharmacy. You know, she consulted with a pharmacist for medications she might fill out.
The question was if we knew on Betsy's visit to the pharmacy if there was some medication or if she consulted with a pharmacist. We don't have that information, and I'm not sure that we can get that information due to HIPAA laws, but we don't have that information right now.
Sheriff?
Sir. At this point, there's no indication that there was a caretaker at the home.
Sheriff, with the footage that you saw of Betsy on February 11th, was there any indication that she was feeling shortness of breath or having trouble moving around while she was running these errands?
You know, we can analyze the video a little more, but it's going to be hard to tell. She was walking around, she was shopping, she was visiting stores, but my detectives didn't indicate that there was any problem with her or struggle of her getting around. So, and I believe she had a mask on also, so I'll have to confirm that, but yeah, that there wasn't any indication of that. Sasha?
I don't know if this is a better answer, but when was the last time you guys dealt with a hantavirus case in San Jose County or responded to one?
Yeah, the question was last time the city of Santa Fe or the county dealt with a hantavirus case. I think we're gonna have to look into that. I'll get back to you. I would have to do some data before we pull that
Have you had any
information.
communication with the CDC? Is there a concern about a bigger public health issue here when it comes to hantavirus?
The CDC is aware of this case. Hantavirus is a notifiable condition nationally. All hantavirus cases are notified to them. This is not an unusual case. We get cases every year, unfortunately. So we're not seeing any indications of any abnormal or unusual patterns.
Dr. Garrett?
We'll go ahead and take 2 more questions, and then we'll wrap this up. Is there anybody that hasn't asked a question yet? Sir.
Do we know, did Betsy communicate to anyone, family, friends, that she was feeling ill? That she became aware?
Again, we're going through some of the communications, and I think the cell phones may have some indications of that prior to the 11th. But as of this moment, I don't have any information that she was indicating that she was feeling ill during any communication. One more question?
Since there's no sense that this is criminal in nature, are you closing this investigation? Are you still going to be releasing body camera footage from the deputies that entered the house? What happens next?
So we will deal with IPRA requests as necessary. If there's body camera or any request for public information, we will be releasing that because of the law. But yeah, we consider this an open investigation until the cell phones, until we finish out the necropsy results of the canine and other loose ends that we need to tie up. But you know, I think we're pretty close to the timeline and with the information that Dr. Jarrell provided.
One question on the heart disease: is it fair to describe this as a heart attack, or is it not? Is that not an accurate term for the heart disease that he suffered?
The question was, is it fair to conclude that Mr. Hackman died from a heart attack? And the answer to that is that it's a little bit difficult to say. I saw no microscopic evidence of a recent heart attack. However, those changes can also take some time to develop, several hours to develop so that I can see it under the microscope. He could have had an abnormal heart rhythm. We already know that he was in atrial fibrillation on the 18th, and that could have evolved into a more terminal heart rhythm.
Is heart failure an okay way to describe it? If we use that terminology?
The question was, did Mr. Hackman have heart failure? Oftentimes we see fluid around the lungs and heart failure and congestion of the liver. I did not see that in his case, but he had very poor heart, or very extensive heart disease. And so he would have been predisposed to abnormal heart rhythms, and hence he had a pacemaker as well.
Thank you, everybody. That'll conclude the press conference for today. Thank you, everybody.
Did anyone else notice that the woman who conducted the autopsies, her body language or something was throwing me off while she was talking? I'm not saying that there's anything to that, so don't read into it too much. But her body language was just throwing me off. Maybe she was just nervous, like she said. Usually, people like her don't speak out in these cases. So, I don't know. That was just throwing me off. But the Hantavirus, what? Now, forgive me. I am no expert on this virus. I was aware that it exists. I know that it's a thing. I know that 2 people died from it in New Mexico in 2023. So I loosely know a little bit about the Hantavirus, but never in a million cajillion freaking years would I have ever guessed that this is what killed Betsy. And even now, even after watching this entire press conference and listening to everything these people had to say, I'm still questioning if that is really and truly the cause of death for Betsy. Now, I'm not saying that there's a big conspiracy or that Betsy was whacked, man. The Hollywood crazies got to her. That's not what I'm trying to say, but I know that this virus is spread through rodents, mice, and rats. So my question is there a possibility that as she laid on the ground for an extended period of time, I mean, it was days before Gene Hackman died, and she was already laying on the ground in the bathroom. And it took so long for her to be discovered. Is there a possibility that mice and rats and rodents could have gotten around her and her body? Is there a possibility that this virus got within her after she already passed away? Maybe there were mouses. I don't even want to think about it, folks, because it's graphic. I kind of hate having to go to these places in my mind, let alone having to talk about it on camera for everyone to see, for the entire world to see, even though the entire world's not watching this video, but you get what I'm saying. But, I mean, when you have someone who's been lying on the ground, deceased, for like weeks, you would say or think that there's a possibility that these rodents, rats and mice, could have interacted with her after she was deceased. But then again, look, I don't know how these things work necessarily. I'm no expert. Like I said, it just makes me wonder. Because we know that Betsy was out and about. In all of her emails, she doesn't mention that she's sick. She's out running errands as if she's feeling fine. And we know from the fire chief there were no 911 calls to her home or anything like that, at least within like the past 3 years. And from everything I've been reading, Betsy was in good health. Now, of course, not everyone knows intimate details about people's lives. So Betsy could have been sick or not feeling well, and maybe she never told anyone. That's very likely. When I don't feel well, I don't tell people. I'm not a complainer. But it just makes you wonder. Because you would think that someone who is literally about to drop dead from this virus would be showing some signs of that. But instead, she was going around and getting her dog food and doing her normal things. Now, she did stop at a pharmacy, so, we got to figure out what she was stopping there for. But then you got Jean. Betsy's still mysterious, but then you got Jean. Now, there has been no mention that I've seen of Gene Hackman having advanced Alzheimer's. I haven't seen any mention of that. None of his kids have mentioned that. I've gone through a lot of articles. I've, read different interviews with friends and acquaintances and neighbors, a lot of which say that Gene Hackman and his wife were very reclusive, even more so before their death. So, of course, he could have been suffering from this, but don't you think that's something that someone should have mentioned by now? But no one has mentioned this, that he's dealing with Alzheimer's. Now, we know that Betsy's mom was suffering from dementia, and Betsy wasn't contacting her mom and hadn't called her mom since like October. So for some reason, we know more about Betsy's mom's mental state than we do Gene. Why do I know that Betsy's mom has dementia, but I don't know that Gene Hackman had advanced Alzheimer's? So Betsy going first and then Gene going second, that makes more sense, right? Because Betsy can take better care of herself than Gene can take care of himself. Now, I've been questioning this whole time, is Gene even capable of taking care of himself? Can Gene even walk and use the bathroom himself? Can he feed himself? Can he make himself a glass of water? Can he even get out of bed? Can he do any of these things? So I've been very curious about that, but from everything I've read, Betsy had this dude doing yoga. There were pictures of them together from not that long ago, out and about buying stuff at the store. I know that Gene Hackman was not doing great. I don't think anyone's doing great at 95, really. But we also didn't know anything about the Alzheimer's. But now we know that it looks like he was alive in the home for like a week while his wife was dead. Now, if he's gone mentally, I guess it explains why he didn't call 911 or something along those lines. I guess you could find those explanations. But we do know, like I was explaining earlier, that he was hydrated. Didn't have any food in his belly, really. Hadn't been eating much, but he was hydrated. So at the very least, Gene Hackman had a glass of water and he was staying hydrated. You know what I mean? So that's just really weird. Because, I was wondering, did Gene Hackman fall and he couldn't get up and he just laid there for days or however long until, he couldn't take it anymore? But, they're saying his cause of death is advanced Alzheimer's and heart disease. I don't know. It's just kind of weird. Now, if my memory serves me correctly, and forgive me because the initial details about this case have changed like 5 times in the course of a week. But from my understanding, the people who actually found out and called 911 to begin with, I believe they were pest control. I believe that they were there to spray the home. I don't know if it was for bugs or maybe it was for mice and rats as well. Maybe it was both. I don't know. But from my understanding, the person who called 911 was pest control. Now, I've heard them described in different ways. I've heard them described as maintenance. I've heard them described as lawn care workers. Different media outlets have reported different things. But I believe they were actually there to spray for pests. So maybe Gene Hackman's home, and a lot of homes in this area, they do have issues with mice, rodents, and what have you. So maybe they were already dealing with the problem there. And maybe, I guess Betsy got affected by it, but Gene didn't. Which is weird because they live in the same home, but then again, I'm sure that Jean isn't really doing much cleaning up. Betsy's doing the cleaning up. So Betsy would be more likely to be exposed to this virus. Now, some of the symptoms you could literally get this virus, from what I've read, and not show symptoms until like 1 to 8 weeks later. It can kind of lie dormant within you for a little while. So maybe that's the case here. But, I mean, like I said earlier, I accept the answers we've gotten, but I still have questions of my own that I would like answered. I doubt they will be answered, but I'm still curious when it comes to this case, because maybe it's just so unexpected, I don't know. But yeah, I am curious as to why was there no mention of Gene Hackman being in such a bad mental condition, and how did he stay hydrated? He stayed hydrated himself, I'm assuming. Just, I don't know. Oh, man. It's just crazy how these investigations go sometimes. You can't figure out the breed of a dog. You can't figure out what dog is dead. But you can figure out that Betsy died of a virus like a week before Gene Hackman dies of heart disease and advanced Alzheimer's, which, by the way, it's also weird because I was recently watching an interview and I read several different news articles with interviews from people who were taking care of Gene Hackman and Betsy's dogs. And they were talking like Gene and Betsy were, interactive and loved their dogs and would joke around with her and stuff. And it's like, so you were joking around and having these lively, thriving conversations with someone with advanced Alzheimer's? I don't know. I literally was watching and reading different interviews from the people who take care of their dogs, and they were talking about the conversations that they have with Gene and Betsy. Now, mind you, these conversations hadn't necessarily happened, in the week that they died, but it was more recent, and they didn't say anything like that. But hey, you never truly know what people are going through. Even when you think you know, you still don't know. So, I accept the answers here. There's still, I feel like so much information was revealed that I really need more time to sit on this information and really think about it. So I'll probably flesh out more thoughts in future videos. But for right now, let's just stew and brew with this information. Let me know how you guys are feeling about it down in the comments below. Let me know if you believe it, you don't believe it. You're welcome to have your own thoughts and opinions here. While you're down there, though, make sure you hit that thumbs up. Make sure you subscribe. Ring that notification bell if you haven't already. And I'll talk to you all very soon in the next one.